Hi there. In this video, we're going to walk through some quick but important tips on how to capture high-quality data using the Eaglet Scleral Profiler. At Acculens, we're passionate about delivering the best possible lenses for your patients. And that starts with capturing the best possible data. The quality of the scan directly impacts the quality of the lens, so getting it right matters. In this walkthrough, I'll show you the general patient flow that I follow in clinic to consistently capture reliable, clean scans. But before we get started, there are a couple of things to note. For the purpose of this video, we have the room fully lit so you can see what we're doing. When you're actually capturing images, make sure the room lights are dim and there's no background light that reflect off the cornea. Extra light and glare will interfere with the scan and reduce the image quality. Now, let's walk through the steps. We'll start by prepping the patient's eye with lubricating drop, a drop that contains hyaluronic acid. Align the patient properly, chin all the way forward in the chin rest, forehead against the headrest. The operator should bring the camera into focus while guiding the patient to look directly at the red cross target. Even before you're ready to take a scan, this is a great time to practice holding the lids. Good lid retraction makes sure the sclera is fully exposed, and it's extremely helpful if the camera display is visible to the person holding the lids. This allows them to adjust their positioning in real time. And also be efficient. The longer the lids are held open, the more likely the ocular surface will begin to dry out, which can lead to poor image quality. So once everything looks good, instill your fluorescein drops, and you're ready to capture your 3 to 4 images. They'll be quick and efficient. All right, let's walk through it all in real time. To capture a high quality Eaglet image, we want to prep everything first. So first we're going to clean up the machine. We're going to get the patient ready by applying some wetting drops with hyaluronic acid. So I'm going to have you look up to the ceiling here. And at this point, I'll just apply a couple of drops to each eye. And then you can dab dry there. Once everything is all set there, we want to get the machine lined up properly. So I'm going to have you bring your chin all the way into the chin rest, and I want you to bring it as far forward as possible and then head against the headrest. Once the patient's here, the operator of the camera is going to line it up, and then we're in the right spot. And then we're not ready to capture an image yet, but here we're going to make sure we have good lid opening. I want to make sure I can do that. So once the machine is lined up, I'm going to ask you to look all the way down to the floor, and I'm going to hold the lids here. So I'm going to hold your upper lid, and now look straight towards the camera. You should see a red crosshair straight ahead. I want you to stare right at that. I'm going to hold the lower lid. Here we're just making sure that we have good clearance over the cornea and the sclera. Once we have that, we're at a good spot. Patient can sit back. The camera should stay exactly where it is, and we'll prep with fluorescein. So now that we have the camera lined up and the patient is ready, we're going to apply fluorescein. What you want to do is take your fluorescein strip and apply a couple drops of the same wetting drops you used to wet the eyes fine. We want to get fluorescein all over the sclera and the cornea. So to do that, I'm going to have you look all the way up to the ceiling, and I'm going to paint some fluorescein the lower limbus area, and then I'll have you look down to the floor. I'll put fluorescein in the superior sclera, blink a few times. I'm going to ask you to look over towards the wall away from us, a little bit nasal, and then towards me, and apply some more fluorescein temporal. Then close your eye. We can dab dry to make sure the lids are nice and dry. You can hold that there. And once that's all applied, we only have a little bit of time to capture images here. So I'm going to have you bring your chin immediately all the way forward, just like we practiced before. Now I'll have you look all the way down to the floor. I'm going to hold your upper lid out of the way and look straight towards that target again. And I'll hold your lower lid. And we'll take a picture. And then go and blink a few times. Look down to the floor again. And look straight ahead. Picture. And blink. And again, look down to the floor. I like to capture at least 3 to 4 images while everything is prepped and ready to go. So you can share at least one of them will be of good quality. Look down one more time and straight ahead. Great. Now you can sit back again and we'll look at the images we got.